It's just that easy.
Well, I didn't get the name of the cicada. It's still at large. So, there's really no police report that could be filed. And so civil suit may be a possibility, but, in a few months, they're going to be gone anyway. And it takes 17 years to file again.
It's hard to recover. Yeah, they got everything hidden in different places.
That's right. So, yeah, this has been quite the week. All right. Well, so I think we have everybody here. We'll go ahead and get going. Welcome everybody to our weekly roundup of everything regarding the COVID-19 pandemic, not cicadas, in the city of Bloomington and with Monroe County, Indiana University, and IU Health. I'm Chuck Carney, Director of Media Relations for Indiana University. We will get started, as always, with opening statements. We'll go first to Mayor John Hamilton.
Thanks, Chuck. Thank you, everybody. This being a health-focused call, I will make a couple quick comments. Happy Pride Month to everybody. That is a health issue, making sure we support and affirm all aspects of Pride Month and related to the health system indeed too. It's also National Gun Violence Awareness Day, which is why I'm wearing orange. And I wanted to just note that as well and thank folks who work on that. Also a major health issue in our community, in our country. So as to COVID, the quick updates from the city: 454 of our employees have filed for the wellness. I keep giving you that number. That keeps climbing. We're pleased with that. That's over half of our regular and part-time, full-time and part-time regular employees. We'll keep offering that $100 and hope folks apply for that, showing they've gotten the full vaccination. This is our third week in a row. We're pleased with no positive cases among our 1,000 or so employees, including temporaries. So there's some good things. Our county continues in blue, of course, but it is significant on the map. If you look, there's one county in the state that's at a 2 rating. There's only one, and it's our neighbor Owen County, our neighbor to the south, Lawrence County, and a couple of its neighbors are one, yellow, as opposed to the orange of Owen County. So we know there's still concerns. We hope things go well there, and their path affects our path as well. The state numbers are improving. Hospitalizations statewide, I know we'll hear locally, are not quite down to what they were in March, but they're heading lower, which is all encouraging. We know vaccinations are how we're going to win. Please get vaccinated. It's safe, it's effective, it's essential, and thanks to all who have gotten vaccinated. And we appreciate everybody talking. If you have any concerns about it, talk to your healthcare advisor, your family, your other advisors, but please get the facts because it is vaccinations that are going to keep us all safe and get us out of this. I want to end this week with special thanks to IU Health. Brian Shockney, you've been such a great partner through all this, through the past 16 months, 15 months. We appreciate that, and your whole system statewide made a major and very important step recently, showing leadership and showing the actions that keep our community safe by requiring vaccinations of employees and those who interact with patients. I know you'll get the exact details. I don't want to get that wrong, but that announcement makes a huge impact on our community, a huge signal of a leading healthcare organization like yours, embracing fully how we win this. And I just, on behalf of all the community, want to thank you and all of your colleagues at IU Health for taking that step. It's very important, very impactful, and we sincerely appreciate it as you've, like Indiana University has done, made that commitment. So happy to answer questions. Back to you, Chuck.
Okay, let's next check in with the Monroe County Department of Health. Today reporting is Kathy Hewitt.
Good afternoon. I'm Kathy Hewitt, excuse me, and the PIO of the Health Department. So today I just want to give you some updates about the cases of COVID in our community. Right now, our weekly caseload is 34 out of 100,000 people, so that's definitely going down, and our positivity rate is at 2.5. We are seeing some variance in the community. Approximately about 40% of the samples we're sending in has been found to be a variant as compared to 50% of state samples. B117, the one that was first identified in the United Kingdom, continues to be the highest level of variance, and that makes about 70% of those identified. We also continue to see some breakthrough cases in this state, but it's very important to remember that even though it's possible to get COVID after you're vaccinated, the cases that you get are very mild and are very low in symptoms, and less than 1% of those vaccinated that become affected, even of that, a very small fraction of that have needed hospital care. So as far as vaccination updates, they have given more than 2.5 million Hoosiers have now been fully vaccinated with over 5 million of doses of COVID vaccine given. And in Monroe County, over 136,000 total vaccinations have been given. And that's about 50%, or 1 out of every 2 people who are eligible have been fully vaccinated for COVID within Monroe County. And another 7,500 have received their first dose of the 2-dose series. So if you haven't yet gotten your vaccination, you can get it at Assembly Hall at IU. I looked on today and there are appointments available. You can also go to most local CVS, Kroger, Walmart. I looked on the map and currently we have over 15 vaccination sites in Monroe County where you can get a vaccine. Starting on 6/21, they will also be available every Monday at the Public Health Clinic. Our Public Health Clinic nurses and our public health staff are also providing outreach vaccination clinics within the community 2 or 3 days a week. This week we went to Community Kitchen and Ivy Tech. And coming up in the next 10 days or so, on June 7th, we will have an Hispanic Latino clinic at the Convention Center, and that's for second doses following our first dose a month ago, as well as some first doses. On 6/10, they'll be at Crawford Homes from 1 to 3. On 6/14 and 6/16, they'll be at Becky's Place in Bedford. And at 6/17, they'll be at Henderson Court from 1:45 to 3 in the afternoon. We're also continuing to brainstorm and look for other places we can go. We're trying to reach those who are especially at risk or those who are harder to access vaccination or harder to reach. Okay, thank you. I'll be available for questions, if any, after.
Okay. Going to the Monroe County Board of Commissioners, I have Lee Jones is reporting here. I don't see Lee on the call, though. I'm wondering if I have that information wrong. It's Penny. Is that you?
Yeah, I'm guess Lee wasn't able to make it, so I'm here to pinch hit.
Okay.
We want to remind people that township assistance is available. If you live within Monroe County, you have a township trustee. That's whom you would go to for that. They can help with rent, with utilities, even with medical expenses. The information about where you can go is on the county's website, either at the emergency management website or in the minutes from the recent Board of Commissioners meetings. But I also want to say that there are businesses still asking folks to wear masks. And I hope you will support them by wearing masks when you enter there. Don't make it harder on the other patrons. Don't make it harder on their staff. They are doing this because they are looking to keep people safe and well. There's a reason that they're asking people to do this, and I hope you will cooperate. Personally, I am making sure that I go to those businesses because I want to make sure that things are good. Thank you.
Let's me unmute, and we'll check in now with IU Health and Brian Shockney.
Thank you, Chuck, and thank you, Mayor, for your comments. Over the past few days, we've seen continued numbers, the same overall COVID numbers as we saw the past week. And so here in Monroe County, it's the same story between Bloomington and Monroe Hospital. So this virus is prevalent and with us. To date, we have now vaccinated approximately 89,616, probably a few more since that statistic came in at noon, individuals at our community vaccine clinic sites, and continue to be proud of the great work our clinics are doing to keep our communities safe. So this week, we did announce our decision as a healthcare system to join many others across the nation in prioritizing patient quality and safety by requiring COVID-19 vaccines to keep our communities, our team members, and most of all, our patients safe. We do anticipate additional healthcare leaders and systems to follow suit in the coming days as we eagerly await the anticipated full approval of the vaccine by the FDA. As one of the largest healthcare providers in the state of Indiana, IU Health is committed to providing a safe place to work and receive care, and will require all team members to be fully vaccinated against COVID-19 by September the 1st. Vaccinating team members is a safe and effective way to protect patients and help reduce the spread of COVID-19 in our facilities and, most importantly, in our community. All COVID-19 vaccines currently available in the U.S. have been shown to be safe and highly effective at preventing severe illness and hospitalization, as well as deaths from COVID-19. Requiring vaccinations for our healthcare team members is not new or unprecedented. IU Health required the flu vaccine and have done so since 2012, along with several other vaccines that we have as a condition of employment to ensure, again, that we provide safety for our family, team members, and our patients. So IU Health will allow team members to apply for deferrals and exemptions from the COVID-19 vaccine based on medical and religious reasons. And then all the applications will be reviewed, and we will grant those on an individual basis as we review them. As a healthcare organization, we do have a duty to protect our patients, to our visitors, our team members by reducing the risk of disease and transmission of any disease. We're committed to providing a culture of safety and have an obligation to do all that we can to protect our patients and our communities that we serve. I want to say thank you to those of you who have been vaccinated. We are where we are today because of the vaccine. The science and the data demonstrate that. So thank you for getting vaccinated. And I will take questions at the end.
Okay, so next check-in with Indiana University and Kirk White.
Hey, good afternoon, everybody. I'll start with the numbers. As I think I reported, with the campus population down, particularly in our residence halls and communal living, as well as the high number of IU people who have been vaccinated, our mitigation testing has dropped significantly because of those that either aren't here or have been vaccinated, which are then taken out of our pool for mitigation testing. This past week, we tested over 1,100 people for COVID-19 with a very small positive rate of 0.18%. Only 2 people of the 1,135 that were tested last week tested positive. So you can see that these efforts work, and we're able to control the virus with vaccine and the kinds of prevention measures that we've been experiencing and had great success with. Overall, through this whole endeavor over the past year, as we've maneuvered through the pandemic emergency, our overwhelming goal has been for the health and safety of our university community, as well as the communities that we serve and where we live and work. Continuing our continuity of instruction, our continuity of research and clinical activities through our healthcare and clinic operations has been vitally important, and we've been able to do that through these many efforts. This past week we did announce, and I'm so pleased that IU Health joined us. That we've both been able, as 2 of the largest employers in Indiana, to have a vaccine requirement. Indiana University is holding firm with that requirement, and all of our faculty, staff, and students will be required to have the vaccine for fall semester. What we adjusted this week had to do with the documentation. And as we look at it, as I look back over this past year, a year ago we were struggling with how we were going to get through this, how we were going to have quarantine and isolation, how we were going to contain the virus, how we were going to adjust all of our classroom buildings, this monumental effort. And this month, a year later, we announced a sweepstakes program, an incentive program to get the vaccine. Much lighter tone than the dire straits that we were in a year ago. And so it's exciting that we've been able to add this incentive program that really encourages all of our folks to get vaccinated and submit their documentation that they have been. It's easy to do. You upload it on the website. And now we'll be having weekly drawings for prizes in different categories for students, faculty, and staff. Students will be eligible for, get this, hey, a year-long free parking permit. Now, what's better than that for students? That'd be great. A $500 bookstore gift certificate, dining and other gift cards of $500 credits. Faculty and staff will be eligible for Apple Watches, AirPods, and Yeti coolers. And our grand prizes will include 1 year of in-state tuition for students, and for faculty and staff, your choice of 2 Colts tickets or 2 Colts season tickets, or 2 season tickets to the Indianapolis Repertory Theater. Lots of great choices. And our first drawing will be June the 10th, next week. Everyone who has uploaded their documentation, be it 4 months ago or just today, will be eligible in that random sweepstakes drawing that we're pleased to be able to announce this week. Overall, we'll be giving away over $70,000 in prizes and incentives for the vaccine. We're joining our other partners all over the place doing the same thing. It seems as a way to kind of celebrate how far we've come this past year. Another good statistic is that we're up now over 36,000 doses at Simon Scott Assembly Hall since the 1st of April when we started. This will continue through the summer. And of course, as Kathy Hewitt mentioned earlier, we've got plenty of appointments available. We welcome you to come to Assembly Hall this summer with your family if you like. Sign up at ourshot.in.gov and get your registration. And you know, one thing I've heard this week is that some people aren't convinced that this is free. Well, it is free. And wherever you go to get your vaccine, whether it be at Assembly Hall or any of the clinic sites, you do put some information down. If you've got insurance, they charge your insurance company. If you don't, the government pays for it. So not to worry, it's free. You're not going to get a bill. And if you do, it's wrong. So go for it. It's easy. With that, I'll thank you all and be willing to take questions.
All right. Thanks, Kirk, very much. First question from Dave Askins at the B Square Beacon for Brian Shockney about that September 1st date for full vaccination. Is that the deadline date for the final dose, or do IU health employees need to have the final dose administered 2 weeks ahead of September 1st?
So we need to have them vaccinated, fully vaccinated by September 1st. That is to say, though, if someone were to get their final vaccine prior to that date, we would certainly honor that. But that, just like any other deadline, you have to set the date, right? And so that is the date that we want to work toward. As you know, Kathy said, there's 15 sites, no less than 15 sites in Monroe County and other counties where people can get the vaccine. So it's easy to do that at any time and make that available. Also, all of our new team members, so as they are onboarding, all of our new team members, just as they have to have their other vaccinations to work in our facilities and have for years, they will have to get the COVID-19 vaccine as part of their onboarding process as well.
Okay, next question from Dave Askins, and apologies, Mayor Hamilton, for this one already. For Mayor Hamilton, is there any possibility that the city might follow the university's lead in offering free parking as an incentive for getting vaccinated? Oh, you're muted still.
Sorry, I never knew how much I'd talk about parking as mayor, but I do talk about parking. Thank you. Thanks for the question. So we actually are, we've looked as a city and talking to city council about different things we can do. As you can tell, we focused on trying to reward everyone as a city employee who's gotten vaccinated with $100. We're continuing to look at options. It is right to think about how do we encourage everybody to get it. No announcement on parking today, though. Sorry.
Okay. Question from Boris Ladwig at the HT. This for Brian, also probably for Kirk and Kathy. How many appointments still available for Assembly Hall next week? What share of that total appointments is available? What share is that of total appointments available, meaning locally? And is there a plan to move into a smaller facility when demand falls further? And there's one other question. I'll save that. Kirk, let me turn to you on Assembly Hall spaces. Appointments still available there. I assume there are quite a few.
Yes, we've got hundreds of appointments next week. I'd have to go on and look and then total it up. But for suffice it to say, in fact, I'll ask while we're on here and see if I can get a number. But plenty of availability next week. And to further discuss the prospect of adjusting the hours and things like that, we meet regularly with IU Health and the county to discuss capacity for vaccinations and utilization. We adjust accordingly, and it could be that I'm sure we'll stay open this summer. What we may do is, shrink the number of employees and the number of vaccinators that we have in place. But I'm sure that we'll remain available through the summer, and we'll do that because we need to keep things ready for those who return in the fall who have not yet been fully vaccinated for whatever reason and may need the doses in the community. We'll be able to still administer that.
Chuck, if I could take that as well. Thank you for the question. We have transitioned our vaccine clinic, doing that currently, at the current site of our hospital, but we've transitioned to our locations, to our clinics, to our urgent cares. So this will be similar to when I turned 50 years old and my primary care doctor said, you need to get your shingle shot. These will be available where you see your primary care provider and also at urgent care sites and other locations. So this becomes part of being well and healing and being sure we're protecting our communities on an ongoing basis. So while there may be vaccination sites that were stood up, as Kirk was saying, during the pandemic, and the need for that mass vaccination, as we move forward with more people getting vaccinated, there will be more opportunity and readily available opportunity with your provider and points of care across the county and across the state.
And Kathy, I don't know if you want to add anything onto that, but let me also throw out that last question that Boris has. What is the projected end to the vaccination effort in Monroe County? I don't know that we can see that end at this point, but Kathy, I'll throw that to you.
Okay, I can just echo what Brian said. The state plan at some point is just to have people get their vaccinations at the point of care. So at some point, the mass vaccination clinics will be phased out, but there isn't a date for that set in sight yet. So.
Okay. Next question, also from Boris at the HT for Brian and Kathy. Once kids are eligible, meaning I suppose 12 and under, to get vaccinations, would local health officials advocate that they be vaccinated, given the children have a very small risk of developing severe illness, but can be carriers of the virus and may congregate more, meaning in schools, than adults do?
Okay, I can start on this. At the state level, only 92 children have been diagnosed with this at this time, and all of them have been released to home. So I would, or public health still does recommend that children would go ahead and get the vaccinations. Even though they might not have severe illness now, COVID has shown to have some long-term effects on people, and they can have continuing effects on different parts of the body later. So it still would be recommended.
I have nothing to add there except that we've seen the 12 to 18-year-olds come in very excited to get their vaccine, and a couple of those stories are posted on our website as well. So I've been very impressed with our children and this generation that are willing and able to get their vaccine.
Question from Boris. This Kirk coming at me and you. Will you require proof of vaccination once there are full FDA approvals for the vaccine? And if those don't arrive before the fall, how valuable will a vaccination requirement be if there's no requirement of proof? There's one other question I'll hold on to, but if you want to take that on, Kirk.
Sure. We take a look at the changing environment and the changing guidance from the CDC and the FDA as it has adjusted weekly, sometimes daily, throughout the pandemic. If approvals come in, and I know that Pfizer and Moderna both, I think, Brian, I think you mentioned that Pfizer has applied and Moderna will be applying.
They actually have, yes, both have.
Great, thank you. So we'll see how that turns out. We're not sure yet how it's going to turn out, but we expect that they would be approved because of the emergency use authorization still had a significant number of safety provisions in it and is considered safe. So at this time, we don't know how we might change things, but our medical response team reviews those changes as they come out and make different changes. So, and going on to your next question, let's see, was there an offer for incentives? Was there a plan to do that all along? Or is this to make up for the university no longer being able to require proof? Well, what we have found is that an incentive program for people who haven't quite made time or on the fence or haven't researched where they could get a vaccine or all sorts of other things, really haven't just stopped and given it serious consideration, that the incentive program that we're doing would help them get over that hump. And that's what it's done other places. So we did not have plans for it prior to last week, but we listened to our own constituencies and the leaders in the state who, as the governor said, there's more than one way to skin a cat. We'll quote the governor, and we're following what he's suggested there. And this is a new way, another way that we can encourage that vaccination rate to increase.
Okay, and there are links, by the way, to the IU COVID incentive program that are in the chat. Kirk shared that as well. And so you can take a look at the full details there. No other questions right now, but I'll hang on a moment as we still have quite a bit of time to go, and we've paid for the time up till 2 o'clock, I believe. So we'll hang on here for just a second. Again, if you have questions, well, here is a question from Adam Pinsker at WTIU. Is IU keeping track of how many students and staff have filled out the vaccine attestation forms since IU announced their fall guidelines? Kirk?
Yes, we are keeping track. I don't have the latest numbers since we just came out with that this week. As a lot of these other systems we've had to put in place and fine tune them. So I don't have a running total yet, but I'm sure as we get down the road a bit, we'll be able to share that.
So still waiting for another question. I'll give it just a moment here. What I was going to say is, as always, for Indiana University, if you have questions about the policy and other things dealing with the pandemic, we have our website at covid.iu.edu where you can find out about the incentives and everything else. And again, that incentive link is now in the chat. So we are hanging on once and twice. And if you have another question, go ahead and get that in there. We are planning on right now being back next week. We're talking about our summer schedule on that, but we'll keep everybody up to date on this. And here he is. I delayed just enough to get Adam a chance to ask one more question. This one from Adam for the mayor or anybody else. Are you concerned that the state of Indiana as a whole lags behind many other states in getting residents vaccinated? And to that point, if anybody gets the print edition of the New York Times or watches it online, there is a chart of all the states, and Indiana is one of the lagging states today. So Mayor Hamilton, I'll start with you on that.
Is this a trick question? Yeah. Yes, I am concerned. It's very concerning, and vaccines are how we win, and it's concerning that we're not winning among the different states. So we got work to do.
Brian?
Yeah, I'll also say it's concerning from the standpoint of if we don't get a large majority of our residents vaccinated, we could very likely risk another outbreak in the fall, as we did past fall, which would put further restrictions on how we live our lives and also stress the healthcare system. From Monroe County, we're being a little selfish about wanting to get as many vaccinated as possible because we are going to relocate to that new hospital on the Indiana University campus at the end of the year. And we would really not like to be fighting another surge in the pandemic while we're trying to move patients to a new facility. So that's a little selfish on our part, but we really do need to get many people vaccinated so that we can move forward with just all the getting rid of the restrictions and being able to live our lives free of this pandemic.
And I don't know if I just want to reiterate and affirm what Commissioner Giddens said too, which is reminding that in a way that's an indicator that it is really important to continue to wear masks and distance if you're not vaccinated for whatever reason. And we hope people will reconsider any reasons, but continue to evaluate those. But we need to make mask wearing and distancing and continued protocols very comfortable for everyone, because if you're not vaccinated, you really should be doing that. And we appreciate enterprises, organizations, restaurants, facilities that are protecting their workforce and others by encouraging that too. It is really serious. There are good indications, but we don't want to be a laggard in this. It's not a good thing.
And I would also add that even though it's really good that 50% of those eligible now are vaccinated, again, that's 50% of those eligible are not yet vaccinated. So we still do need to keep that in mind. And as the mayor alluded to, our neighbors to the west and to the south both have higher rates than we do in this state. And we are a regional hub. We know everybody comes to Bloomington to shop, to eat, or to work. So we need to keep that in mind and encourage everybody we know and everybody they know to get vaccinated and continue to protect both ourselves and our neighbors.
And worth saying that even if you don't win a prize, don't get free parking for a year, you do get that immunity with the vaccination. So that is probably a better prize above all others. So we do absolutely encourage it. Well, seeing no other questions, we'll call it a day there and plan to be back next week at the same time at 1:15. Thanks everybody for your questions. We will see you then.
Thank you, Chuck. Thanks, everyone.
Thank you all.
Have a good weekend.